Hello, everyone. If you've been searching for medical social work interview questions, you likely already know that the healthcare world moves at a different speed than traditional clinical practice. Today, I'm going to teach you exactly how to pass a hospital social work interview by speaking the language hiring managers really want to hear. We're going to go beyond the basics. I'm going to show you how to demonstrate mastery in interdisciplinary discharge planning, how to conduct rapid high-risk patient psychosocial assessments, and how you can prove that you can navigate the complex world of healthcare compliance. Whether you're a new Master of Social Work graduate or a seasoned clinician transitioning into the hospital setting, this is your step-by-step guide to turning your clinical background into a competitive advantage. Let's get you hired. Before we get into the how-to, we need to understand the why. Transitioning from mental health to medical social work involves a shift from long-term therapy to rapid crisis intervention. Hiring managers in healthcare prioritize cross-functional healthcare collaboration and speed. They need to know you can operate within a rigid regulatory and financial constraints of a modern hospital. Now take a look at these stats. The average acute care stay is just under 5 days. This means your window of intervention is incredibly tight. When answering MSW hospital placement interview tips, emphasize that you understand this urgency. You aren't just a therapist, you are a coordinator ensuring a safe, timely transition to the next level of care. To master discharge planning in an interview, explain your step-by-step process. Show how you initiate contact early and work alongside the interdisciplinary team to clear hurdles before they delay a patient's exit. Mentioning your comfort with insurance and community resource linkage is a huge green flag for managers. High-risk patient psychosocial assessments are your primary tool for crisis intervention in a hospital setting. In your interview, walk them through these pillars: cognitive capacity, immediate safety, and social determinants. Proving you can screen for these rapidly shows you can handle a high volume environment of an ER or med-surg floor. Security is paramount. Mentioning healthcare compliance and HIPAA standards show you respect the legal liabilities of the hospital. If you've used electronic health records before, say so. Managers want to know that your documentation will be audit ready and professional every time. Managing social determinants of health, or SDOH, is a massive priority for modern healthcare systems. Explain how you look beyond the clinical diagnosis to see the environmental factors. When you talk about reducing readmission rates by securing stable housing for a patient, you are speaking the CFO's language as much as the hiring managers. Frameworks are your best friend for medical social work behavioral interview answers. Most people use STAR, but I recommend the PEARL method for medical roles. It includes an evaluation and learning phase, which highlights your clinical reasoning and your ability to adapt your practice based on previous experiences. Remember, stories stick. In your interview, share a success story about teamwork, like this example of Mr. J, who was a patient with a severe heart failure and whose discharge stalled due to home oxygen barriers. By leveraging cross-functional healthcare collaboration, the social worker partnered with the cardiologist and an outside vendor to secure funding within 2 hours. It shows you aren't just working in a silo, you are a vital part of the medical team's success. Once you're in the role, the challenge shifts to maintenance. To impress a hiring manager, you must show you have a plan for managing the massive volume of documentation and timekeeping required in medical settings. Let's look at how you can streamline your workflow. Hiring managers love candidates who mention systems. For example, Case Management Hub and sending out a SOAP note is super simple. You move through subjective, objective, assessment, and plan, then submit. Mentioning your 5 steps workflow for documentation proves you won't get buried in paperwork. So let's recap the core pillars we've covered today so you can walk into your interview fully prepared. First, you need to speak healthcare. This means framing your answers around rapid interdisciplinary discharge planning and cross functional healthcare collaboration. Hiring managers aren't just looking for clinical empathy, they need to know that you understand hospital metrics, like minimizing the length of stay and avoiding costly readmissions. Second, master your presentation frameworks. Move away from generic interview answers and utilize structured communication like the Pearl framework. By adding those explicit evaluation and learning phases to your stories, you prove to the interviewer that you possess advanced clinical reasoning and a commitment to self reflection. Third, balance urgency with ethics. You must show you can work efficiently within a tight 4.5-day acute care window without ever taking shortcuts on healthcare compliance or HIPAA standards. Your case notes should always be presented as an essential legal safeguard for the hospital system. Fourth, actively manage social determinants of health. Always look beyond the immediate medical diagnosis. Explain to the hiring team exactly how you evaluate and mitigate environmental barriers like housing instability, lack of transportation, or food insecurity to stabilize your patients long after they are discharged. And finally, embrace operational tools. Stand out from other candidates by discussing your approach to workload management, expressing familiarity with a modern all-in-one platform like Case Management Hub to streamline your daily workflows. From intake forms to SOAP notes, signals that you are organized, tech savvy, and ready to hit the ground running from day one. You now have the clinical strategy to ace your interview. But remember that landing the job is only the first step. Once you are on the floor, success is about how you manage your workflow. If you want to stop drowning in administrative paperwork and start focusing on your patients, click the link in the description to start your free 21-day trial of our all-in-one case management software. It is the easiest way to handle HIPAA-compliant documentation, secure data storage, and patient tracking without the stress. Once you click the link, you'll be brought to this page. Just enter your first name, last name, and email, as well as your organization name, and select your practice area. We also recommend that you enter a phone number. Once you're done, you'll be brought to the main dashboard, which allows you to perform quick actions among many other things. Let's take a look at how you can easily create a SOAP note in Case Management Hub. Step 1, we're going to navigate to the Notes module from the sidebar. And then we're going to click Add Note. Step 2, from the Note Type dropdown, select SOAP Note Template. Step 3, add your note details to the 4 sections of the SOAP note. Select the client and then click Save. Step 4, you can view, search, and filter all of your client notes, including the SOAP notes, in one place. Step 5, click the eye icon to view or edit the details of the note. And don't forget to like this video as it lets me know that you've received value from it. You can also subscribe to the channel so you don't miss great content like this one.